Welcome to the Long Story Longer podcast.
I'm Dominic Marano. I prescribe meds.
And I'm KatieBrzyzowski, and I provide psychotherapy.
Long Story Longer is a podcast about mental health and navigating medication, therapy, and whatever else we want to talk about.
We will discuss topics from each of our perspectives. We will try to keep it to 15 minutes.
But it will probably be longer. Hello and welcome to the Long Story Longer podcast. My name is Dominic Marano. I am a family and psychiatric mental health nurse practitioner. I own my own psychiatric practice and I have a doctorate in the nursing practice. I've been in healthcare for over 20 years and more recently into mental health.
Hey, I'm KatieBrzyzowski and I'm a licensed clinical social worker and I have a doctorate in clinical social work and I own a private practice and I've been in the mental health profession for over 25 years.
So I wanted to start off today's podcast with a little story. As I was waking up this morning and going out to my car, I look on my dashboard and I have this orange light that says low tire pressure. The fall is upon us. So our topic today is going to be something that I actually treat a lot of in practice. It's something that's, I think it's pretty easy to spot for most. It's called Seasonal Affective Disorder, or SAD.
Perfect acronym.
Yeah. People who have SAD, as it turns out, are sad to some degree.
So we have a joke that in around April, people start feeling better. And then we're like, oh my gosh, our work is finally paying off. Like they're finally responding to therapy, but actually it's just April. And now they don't have SAD anymore.
Yeah, so let's talk about some myths about seasonal affective disorder. First to start, seasonal affective disorder or SAD, it happens during certain seasons. Those would be the fall and winter months. That's why during the spring, everybody perks up a little bit.
But also, the very small percentage, what is it, like 5%, happens in the summer, which actually makes sense because if you don't like the heat, then you might feel more confined to having to be inside or whatever. But that is more rare, but can happen in the summer. But
I find people, heat intolerance is a big thing. And there are a lot of physiologic causes for that. So if people have chronic disease and they can't tolerate or thyroid issues. But you're right, I have a subset of people who are looking forward to the cold weather. Not very many, maybe 5%.
I have people like that too. Yep, they're miserable in the summer and as soon as it starts getting cold, then they're fine.
It's one of the more common myths or misconceptions is that SAD is just holiday stress or back to school blues or any of that, but that's false. It can last upwards of 4 to 5 months, and it really correlates to the amount of sunshine that people experience, being cooped up in the house, the cold weather, and how that impairs your ability to do things that you could normally do in warm weather.
And it's not just laziness. It's not just another myth is that it's just like you're being lazy in the winter or something. It's not that you're lazy. It's that this is a biological condition. This is actually depression.
Yeah. So let's compare and contrast winter seasonal affective disorder and summer seasonal affective disorder. So winter seasonal affective disorder is characterized by depressive symptoms. You think about like fatigue or oversleeping or social withdrawal or lack of interest in things that you would normally do that you could do in those seasons, carb cravings, just pretty consistent things, and that go on for a duration of time. I think, even with regular depression, it's temporal. There has to be a certain amount of time and it goes over for a period of time that's consistent. And then with summer, people experience insomnia or restlessness or loss of appetite or anxiety. These are things, some people are very sensitive to sunlight.
That's why the sunlight part isn't the problem in summer.
Well, it isn't, but also like you can see restlessness. We can talk about the pathology behind it is that your circadian rhythm is based upon your light exposure from the sun. So in the morning when the sun comes up, you're exposed to that light, even with your eyes closed. Melatonin is production and other hormones that cause sleepfulness or wakefulness. They just change with sunlight. So when there's not a lot of sun, the ones that make you sleepy rise. And when there is a lot of sun, they go down.
Okay.
So that's how our circadian rhythm is established. And again, patterns, as we talked about in sleep, the sleep pattern, once your brain realizes what happens, it anticipates that too.
And then when you add in the serotonin decreasing because of the lack of sunlight.
Yeah. And that's Think about it. You have to, there's a number of reasons. Well, one, because of lower serotonin for sure, but you can't do the things that you want to do. The things that make you happy make you happy. Sunshine makes a lot of people happy. Think of
Yeah.
a cloudy, cold day, and then you think of a warm, sunshiny day.
It's just a two completely
Yeah,
different.
you think frowny face, smiley
Yeah,
face, you know?
exactly.
Melatonin is disrupted during affected sleep cycles. So during the day, if you're exposed to a lot of darkness, you may feel sluggish. You may want to take naps. I think we talked about that with sleep as well, that if you take naps or even are just sedentary, it can impact your ability to function and then impact your ability to sleep later. The caveat is just looking at the time. It's 84 degrees today, but it was 50 something degrees this morning. So it's like you go from a hot box to a refrigerator during the course of the day. So you can see that when the things are cooler, this is the red flag for me to know that SAD is coming.
That was why the tire pressure was like,
Yeah, it said you have to remember to ask people if they're taking SAD medications. Yeah, we'll get into treatment, but earlier treatment, kind of nipping in the bud, is one of the more common practices to do. Whereas today, again, it's sunny, it's lovely. I will ask whatever thing in the house that we can ask questions to, whether it be my phone or a speaker. What time is sunset? Because I know that's when I'm going to less likely to be less productive because I try to work out before just the time before the sunset so that I can get that in. But that also is impacted for me when there's less sunshine. So we know that that's coming. And I've noticed it because initially I was like, whoa, we used to have sunset at 8 o'clock. Now it's
yes,
finish. Yeah.
yes, yes.
So we can talk about some treatments. I think this is one of those, as we talked about in mental health, there can be some mental health conditions that are more responsive to therapy and some that are more responsive to medication.
This is a medicine one.
It is.
Yes.
It is. I would say for those who can tolerate the medicine, there's a couple different ones. The standard is for bupropion, the extended version. It's FDA approved for seasonal affective disorder. People who take it and can tolerate it love it. It's one of those things, as we talked about, with the opposite of what you're feeling, what could be some of the side effects of that. So if you have a lack of energy, the opposite of that would be restlessness, which is a side effect for some people of that medication. For people who are craving food, it can actually suppress hunger. So for some people, that's not ideal, particularly if they have any other eating issues or have calorie requirements or things along those lines. It does treat the SAD symptoms, but sometimes they're a little too excessive in treatment and can be more anxiety type symptoms that you experience with that. But it is really, really good. Sometimes it can affect sleep as well, where people are too awake, but there are also different preparations of that. Again, the XL is FDA approved for a treatment SAD, but I will use the sustained release one for people who have sleep disturbances from the medication itself.
Okay.
Other options include other SSRIs. If someone is experiencing SAD or even depression, sometimes you use off-label medications if someone can't tolerate bupropion. I'll use like a Lexapro, low-dose Lexapro or escitalopram, or just something that they've known would work before. Again, not for the clinical indication for SAD, but off-label use for that is certainly one of the things.
I have a question about that. If you are prescribing those things, would you just keep them on it when it gets nicer out, or do they go back off?
No, they go back off.
Okay.
You have to look at the cause. So if this is something to where someone's neurobiochemistry is only impacted during the fall and winter months, they would only need an intervention during that time. Most people will know that I have people who are on the bupropion who are normally on 300 milligrams, right? Between the spring and summer months, that's all they need. So they do have an impact of their neurobiochemistry, but it gets even worse during the fall and winter months. So we'll go up to 450. The nice thing about the bupropion is there's 3 doses for the extended release: 150, 300, and 450.
So
I start off at the lowest and work my way up. And then if someone can't tolerate a higher dose, we just work our way back down. Again, there's only a couple gears you can go in this vehicle. So it's as a clinician, it's a very simple approach to treatment from that. There are other non-pharmacologic treatments. The one that I actually, and I'll even like prescribe it, like I will say, this is what I am prescribing you, is light therapy. So light box therapy is often used. It's kind of like supplemental sunshine, if you will. And it has to deal with there's regular normal sunshine that comes at a certain brightness, and then there's artificial light that comes at certain brightness. Prescribed daily. The light actually helps wake people up. I don't know if you've ever been in the dark. Someone flicks the switch on, you're like, like you just
Don't they make alarm clocks like that too, right? And
Yeah.
stuff just because the light is so it does help you wake up.
There is a TikTok. Did you ever see the one where the bed throws the person? But that would be useful as well. But yeah, it's so the thought process behind that is that your brain doesn't know whether light's artificial or not. Stimulating those things where you're going to decrease the amount of hormone or chemical in your brain that causes you to be sleepy and, enhance the wakeful ones. But you would do that 20 to 30 minutes in the morning. I can remember even as far back as the 80s, my mom had a light that she would just sign. She said it just made her feel better. I think it also made her tan too.
Oh,
But but I can remember her doing that, and she was just someone very super sensitive to sunshine. So I do those things that come on. You can get them on any. Like, well, I guess we can name drop, right? Like on Amazon, relatively cheap, around $15. All light boxes are not the same though. The thing to pay attention to is that it needs to be 10,000 lux, Lux. It has to do with the brightness to be able to be an effective treatment.
because otherwise you could just use a lamp. So it has to be something like specific for this.
Yeah, yeah, and I think that even now they're coming out with, like it's upcoming, like, blue, orange light devices for melatonin sync, for better melatonin sync. So, I mean, there's still a ton of research out there that there's something for everything, and then there's some things that work. There's some, holistic things that people do as well, but the FDA approved stuff, there's tons of research supporting light box therapy. The people who love it, love it.
I will admit that I tend to miss SAD as a diagnosis sometimes, or not miss it, but I don't think it's the first thing in my head, even though now that I'm working with people for years, they will get more depressed over winter. I don't think I was tracking it in that way. Like, okay, this must be because people have a lot of things going on. And when you
Yeah,
see people,
situational, sadness, right? So it happens, like, throughout the course of the year, things can go up and go down. So your exposure may be one that, like, different from medication, where, like, someone's sad because they've had, well, not seasonal affective, but someone's depressed because they had a life event happen, or
and the holidays stress everybody out. So
sure,
everybody in here is usually upset around the holidays. So I think I usually attribute it more to that,
yeah.
but it would be beneficial to think of SAD
In the
more
differential.
often.
Yeah, yeah,
Yes.
yeah. But I think we talked about before how people are like, "I don't wanna be on a medication." But you can tell someone like, "Hey, it's only for the fall and winter months." That's a sell.
Yes, you're right. Yeah, because everybody wants to know when they can get off of it when they're getting on a medication. Like, "Do I have to
Yeah.
take this forever?"
Yeah, and then sometimes you do, and sometimes you don't. So, but for this, it can either be an increase in medication or an initiation of medication, but then a taper down or a taper to off.
And for other treatments, like things that your therapist would do is CBT. We would use CBT like just like you could use CBT for sleep and a bazillion other things, using the way you think about helping with cognitive restructuring.
I think an example could be like, I can't do anything. There's nothing to do. And then you could be like, well, is there really nothing? It's almost like an absolute. Like there's not nothing to do.
Right, right,
There's
right.
something to do. You just have to figure out, and maybe that's something in therapy you do is like, hey, during the winter months, I'm going to take up knitting because who wants to knit in the summer? Some people do, I guess, but in the air
Right.
conditioning,
It had to be. CBT can help to reframe negative thoughts, but then also working with your therapist on planning. So basically, like, what can we plan? We know that the winter is going to be tough. We know that every year, get a little down. Let's plan some things. And I actually, with one client, we do have her planning a trip to where it's warmer, and she does that in January because she knows January is going to start getting bad, right? So like trying to plan things. Not everybody can go away, but like just different ways to. Okay, so this is maybe make your schedule so you're working in when it's dark and you have some time in the afternoon to go out for a walk or something, so that you can still get the light. Like just ways to accommodate the change better.
yeah. And I think that you hit the nail on the head. Like travel, people during the winter months, I think snowbirds we called them. They're down in the south for the winter because one, the weather's nicer, but you get more sunshine. You just
Mm-hmm.
do. So I think it does give a little break. It can make the sad less heavy if you then have exposure to light. Plus, like then you don't have to deal with work and all that stuff. So you can alleviate your stressors. And sometimes in mental health, it's a scale that tips. So you may be fine, spring, summer, beginning of fall, and then it tips because you don't have the things that make you routinely happy, that give you happiness, that give you joy, that you look forward to during those winter and fall months. And again, the complete opposite for that minority of people who experience it during the summer months.
And then you add in holidays, as I mentioned, holidays can be very sad and stressful. And you not only do you are experiencing the sadness of different things around the holidays, but you're experiencing that in a time when you're not at your best because you don't have the summer
Sure,
and the beach and the
sure.
things that might maybe and the light that
It
might
would be
make you
interesting
happier.
to see, like, so say for instance, if someone has a holiday is certainly something when you miss somebody. If you had two similar experiences where you experienced a similar, I don't know, thing that causes depression or sadness for you, but you had it in the summer versus having it in the winter. That, like you said, that since you're down, where I think that an example would be like when somebody dies versus their birthday. Sometimes they can be in different seasons. Now, it's still reminding you of that person. They are surrounded by different experiences, so it might
Right,
be a little
right.
different, but it's a scale. Things
Mhm.
tip, and if your neurotransmitters aren't at their fullest best potential, then you could certainly experience your depression with that.
I think it's hopeful to know that you can put these things in as preventative measures. So don't wait until mid-November to get your get your light box, to start your strategies. Make sure your sleep hygiene is good. Like, don't start and when you're already
Yeah,
feeling that
in the
way.
thick of
Start
it,
now.
nip it in the
Yes,
bud. That's as I
exactly.
said. Something we didn't talk about were statistics, which is I like to hear statistics, so sometimes it sticks with me. 5%, roughly 5% of adults experience SAD annually. Sometimes some people can experience it some years, sometimes others, but 5% consistently. Additional 10 to 20% experience a milder version of it. Women are about four more times diagnosed with it than men. This
That
is
doesn't mean that they actually experience it 4 times as much or just diagnosed 4 times as much.
yeah,
So
yeah.
maybe
I mean,
men aren't getting diagnosed in the same way, or you
and
think
I would just say this too, Wellbutrin is such a male-friendly medication. So, because it's not like the other SSRIs, and again, I think we talked about this with women that men tend to have a higher propensity to steer clear of any drug that's gonna affect sexual function, at least, and this might be anecdotal just for me,
mm,
but no male that I have is like, "Yeah, go ahead, kill my sex
right.
drive."
I see that too. No, I
I
see
think
that too,
women are
yeah.
a little more giving with that, and that may be, like, hormonal too. There's fluctuations of hormones with women way more than men, so they might be more accustomed to varying sex drives.
Absolutely, and age yeah, because in the age ranges.
Other things, symptoms usually last 4 to 5 months a year, as we said. Light therapy, it helps, reduce the symptoms of SAD. It helps about 60 to 80% of people reduce those symptoms, and
You're
another thing
welcome, light box sellers.
yes.
For our
Another thing I forgot to mention, which is important, and I do check this during the winter months when I get my labs on people. Sunlight is responsible for vitamin D production within our, like to get those sunlight converts whatever in our body to vitamin D. And during winter months, that's more common because you're not exposed to sunshine as much. So vitamin D deficiency contributes to 64% higher risk of depression. So there could be some components to that in terms of the causes that we talked about before. Just a little late addition of statistics there, but
We don't wanna leave them out
I
and
didn't really amount.
or re-record the whole thing.
No, no, we definitely don't want to do that. But I think the take homes are when that light comes on the dashboard. Now is the time to start screening people. Are these noticing patterns? Asking people, "Hey, did you ever notice during the winter months if you experience sadness?" We talked about this before for depression scales. I get a baseline scale on anyone when they come in, and then you're supposed to repeat it a couple times a year just to see if there's any varying patterns. You could also look at them and see, oh, wow, your depression scores during those months are significantly higher versus, during the summer months. But having a baseline for them, comparing them, taking note of when they change. Like you said, start early, start the treatment early. Here's the thing, too. This is the really important part. The bupropion, wonderful medication, takes 6 to 8 weeks to work at its highest efficacy, full efficacy. You'll notice within the first 2 weeks or so a change, but it's gotta build up. We don't wanna change your neurobiochemistry too quickly. The brain does not like that at all. It's a
Oh,
medication we don't give to people with seizures because it lowers the seizure threshold. So you can be, if you're on an anti-epileptic, sometimes there's a little waiver with that, but most people are very wary of that. Also, for people with eating disorders, we don't give it because people with an eating history of eating disorders are more, for whatever reason, more prone to seizures as well.
and this is why it's very good, I think, to go to a specialist for your medication like this.
It's nuanced care. So we should start early, and then the other part of is to show compassion and self-compassion. This is something that happens. It's a pattern of sadness, depression. It's real, it's treatable. Sometimes just light box therapy is enough, and you don't necessarily need to go on medication. Sometimes people are like, I don't want to do anything. I just want to be aware that this is going to happen.
Yes, I think that's a really important point because with anything, like we're talking about that for sad right now, but really in anything, sometimes like with ADHD, people are like, I don't want to get on medication. I just want to get tested to know if this is what I'm dealing with or whatever it is.
Yeah,
Just
well,
knowing.
and accommodations can be made when somebody finds out, again, you have ADHD. You don't necessarily have to have any sort of intervention, but if you need a little longer for a test, or you say you're experiencing have seasonal depression, go a little easier on me just because I'm feeling a little down. Like being aware of that, giving yourself the kindness, then others giving you that kindness back as well. Being aware that mental health impacts us all. And you're not alone. There's so many people who experience that, even more who have a subclinical presentation of it as well. Well, I think that may have been one of our shortest long story longers
Say it isn't so. How'd we do it?
in a long time. Maybe either A, we're getting better, or there's just not that much to talk about sad.
Maybe that one.
Yeah. So I guess the reason why I'm such a fan of treating SAD is because it is pretty straightforward for those who can diagnose and treat, and for a prescriber, I should say. So I think that wraps up everything. Remember, if you have any questions, any thoughts, please let us know.
And we'd love to hear your experiences. What works for everybody else for this or when these
Yeah, it's not a
winter months.
research-based treatment. I mean, holistic care is bringing all different pieces like, who knows? I don't know if meditation helps with that. Probably does. If cognitive behavioral therapy helps with it, just having an awareness of it. Who knows? But different things work for different people, and if you have a treatment that works for you, it may work for others.
Yes, so let us know.
So yeah,
And
check your dashboards.
if you know someone who is already starting to dread these shorter days, then send them this episode.
Exactly. Nip it in the bud. Don't be sad.
Bye.
Bye.